Today's topic, I'm going to talk about gyroscopy of non-scarring alopecia. Non-scarring alopecia differ from scarring alopecia by the absence of follicular scarring. So you can see on one side, the hairs organized in follicular unit, and on the other side, you can see area where follicular units are absent. In the biopsy, that present as fibrotic tract. I'm going to cover the most common non-scarring alopecia: diffuse non-scarring alopecia, telogen effluvium, androgenetic alopecia, alopecia areata incognito. I'm going to talk a little bit about patchy non-scarring alopecia, such as alopecia areata and trichotillomania. So what about normal scalp? In the scalp where the hair is organized as you see in follicular unit, in group usually about 70% are organized in group of 2 or 3 hairs. About up to 20% are thinner hairs, the rest are thick hairs. And remember that the temporal areas in women have lower hair density. What about telogen effluvium? Telogen effluvium is a very common in the hair practice. Usually patients have full head of hair, but they are shedding more, and you can see here on gyroscopy that we don't have specific features. But we don't see hair shape variability, so the hair look uniform, they are organized in group. We can see short regrowing hair, and you can see is some empty dot, which are a solid opening of the follicle without hair shape. On biopsy, the picture look like normal scalp. This is a normal distribution of the follicular unit, organized with their sebaceous gland. There is no hair shape variability because the terminal to vellus ratio in this case is, for example, 7:1, which is normal, and we have normal telogen count in alopecia areata. You know this is a condition that go through stages. In the acute stage, where the patient see the patch, and the patch is just a recent onset. Patients usually have also a lot of shedding. You can see this yellow dot, and you see a black dot and broken hair. What are the yellow dots? These are the infundibular black with sebum and keratin. They are not visible in fit body skin type 4 to 6. Keep that in mind. In the subacute stage, the patch is still there. Patient may still be shedding. The condition continues without resolution. You can see broken hairs and black dots. I will talk about the dystrophic hair on the next slide. And in the regrowth stage, we see the circle hairs, which look like pigtail hairs. They are type of short regrowing hair. And chronic stage alopecia, we see yellow dots without regrowth. So these are examples of the dystrophic hair. They could be black dots when the fracture in the affected hair shape occur prior to exiting the scalp, or they can be broken hairs where the fracture occur after exiting the scalp. Exclamation hair come from the resemblance to exclamation mark, and they are considered specific for alopecia areata. You can see on the biopsies, the dystrophic hair actually correspond to follicles affected by the loss of immune privilege and the presence of this lymphocytic infiltrate that invades the bulb. The matrix of the follicles and resemble the swarm of bees. Infiltrate. These are examples of regrowing hair. We have upright short regrowing hairs, and we have circle hair, which correspond to vellus follicle, intermediate size terminal anagen follicles, and patches with recovery. Keep in mind something important in repubertal children and in adults after menopause or andropause. The sebaceous glands are atrophic or hypoplastic, so they are not able to fill the infundibulum with yellow sebum. That therefore the yellow dot may be absent, and it could be a common mistake to call this scarring alopecia because of the absence of yellow dot. In alopecia incognito, which is characterized by the few Arab shedding, you can see here that there are no specific features, but before we see yellow dot, before treatment, some yellow dot, some short regrowing hair, and after that we see improved hair density. And this is important. You can show the patient how they can appreciate the improvement on their own. In androgenetic alopecia, which is the most common condition in the hair clinic, the main feature is hair shape. For variability, there is a follicular miniaturization. The terminal to vellus ratio is less than 2.2 to 1 because we have predominant of vellus or thin hair. And you can see here that there is a clear hair shape variability on the microscopy. We have yellow dot, we can have that in androgenetic alopecia as well. This is not a specific feature for alopecia. We have vellus hair, which correspond to the thinner hair shape. Some intermediate hair, meaning that the diameter is between vellus and terminal hair. And we have also single terminal hair. So this is the main feature, hair shape variability. This is increased number of follicular units with single hair in the frontal scalp in allogenetic alopecia. What about trichotillomania? Trichotillomania is characterized by hair broken at different lengths. So you can see this seminar paper on trichotillomania describing the different type of broken hair. And this is an example. So we have hair broken at different lengths. We have coil hair, flame hair, look like a flame broken hair with clean tip. And then we have also some circle hair. Look at the coil hair, it does look like a question mark. And we have black dots, which are the type of broken hair. As we discussed, tulip hair is where the tip are a little bit darker on biopsy. They correspond to this distorted hair shape in follicular canal, trichotillomania, with a drop of the pigment from the cortex in the follicular canal called pigmented cast. Don't mistake that the tinea capitis, because tinea capitis is really easy to distinguish on trichoscopy. If you identify the common hair is considered specific for tinea capitis. Thank you very much for your attention.